Morning, Colin. Hope you're doing good. Thanks for meeting with me this morning. I wanted to take some time this morning to get with you and discuss about the League City hospital expansion that's coming up, and discuss some things, some opportunities that we could take advantage with this project to help and take UTMB to another level with this project with the facility when we do the expansion. Some things that I've been talking with my team about that we want to focus in on, specifically, obviously, with patient experience. I think it would be good as we get into the program that we do a post occupancy survey uh, of the existing hospital at League City and Clear Lake right now. Since we're going to be doing the expansion there in League City, it would be good that we go ahead and survey those patients that are coming to that hospital to get feedback as far as what they like, what they don't like, so that we have that information when we go into the program and the design, and we can start focusing in on those touch points with the patients. It would also be good, we're going to do that automatically, but also with the physicians as far as the work environment. We're going to be doing some survey with the actual staff themselves and the existing ED of some things of what we can do to improve their work environment as well. Um, We've been talking to our MEP engineer that we currently are using to do the programming with. Um, we're going to be looking at trying to see how we can implement out at the central utility plant some more sustainable technology with our emergency power generation, potentially pulling in a gas line so that we can go ahead and get efficient in the event that we need to at night, putting basically power back on the grid. There's also been some discussions about making sure that we do some heat recovery wheels inside some of the air handler units so that we can try and reduce some of the efficiency losses that we're having inside the building. Um, we're going to bring EAB on board who can run some models for us regarding some of this equipment that we're planning on purchasing based off the load quantities that we're going to see inside the building. Um, what kind of return on investment so that we can see how this could pay back that equipment long term. So when we take it to leadership, some of this equipment may come with a little bit of a premium of a cost, but long term it's going to pay itself off just based off the energy efficiencies that we have. And I think that it's definitely taking it a step above what a lot of the adjacent competitors, Memorial Hermann and HCA in the area, are doing with their buildings, to show that we're being making good use with the environment and whatnot and energy consumption. Not to mention, I know UT Systems, which we're a part of, is having an initiative trying to go ahead and reduce energy consumptions with a lot of the facilities that we have. And so this is something that we can report up to the Board of Regents as well and market UTMB in that fashion. Um, we also we're going to go ahead and look at expanding the conference center so that we get some additional training locations and we can implement some of the telehealth uh, offices in there for the physicians. That's kind of the direction that a lot of the healthcare is seeing in the industry is going. People don't want to come in for a doctor's visit; they prefer to go telehealth, and so we can go ahead and expand that with some of the new technologies we have. Obviously, since COVID-19, going remote has gone huge, and so we need to update some of our technologies to do that. That will also assist with also bringing in some of the physicians, because they can also work remotely too as well, but they also have a spot to come in and carry on some of those telehealth appointments as well. Um, with this project, we are going to continue using Zero Six as a consultant to come in and look at our envelope system. Obviously, we do have to meet TDI requirements with windstorm, with meaning not we got to basically our envelope cannot has to exceed 120-mile-an-hour winds. But we're going to look at going ahead and making sure that our building system can withstand up to 160 to 180 mile an hour winds. And we're not just going to build it, but we're actually going to test it. We're going to build some mock ups and we're going to test the systems. And then we're also going to test the systems in place, to ensure that whatever we actually build, um, it in fact was verified that it in fact can withstand winds that exceed 120 mile an hour winds. That's going to assist us with our premiums on our windstorm insurance that we need to go through the state with. And I know the state is always interested because we are in Hurricane Alley here on the Texas Gulf Coast, being in League City, where we're doing this expansion. Um, Another thing we want to do, Colin, that I think the leadership's going to be really, really interested in. It's being done over at MD Anderson, even though they're not one of our competitors, but they have taken it to another level with some of their facilities and the future design that they have over there with some of the research buildings, and I'd like to implement it into our hospital. But we want to go ahead and implement some of the automated controls along with some of like the automated window shades so that as the sun comes up and over and the heating changes from one side to the building, we can go ahead and start having the window shades come down automatically, which helps reduce some of the heating that goes on with the windows that we have since we have a curtain wall system that's going to be on the side of the hospital. Patients will obviously be able to override those controls if they want to let light in. But in the meantime, when a patient room is unoccupied, those blinds will come down automatically to help reduce the amount of energy that we're consuming that we're trying to take outside the building that's coming in through the windows. Um, we're going to update some of the infrastructure we have in the IT closets in order to support the Epic the healthcare system uses online for all the patient records. Epic, they're going to be going to a new software, rolling out a new enterprise. I think this is something that needs to be done to support that initiative. It's not happening right away, but we're going to go ahead and put that infrastructure in right now to support that initiative in the future. And at the same time, we are talking about in some of the spaces on the med surge floors, we're going to go ahead and build out a couple extra rooms as far as to support the academic side. We get a lot of resident doctors that are coming in for training, and we need to have these extra teaching rooms so that we can implement the academic side along with the hospital. Um, and that also helps recruit a lot of the residents where they want to go in order to complete their residency. And we also want to go ahead and attain a lot of physicians that want to be part of this academic teaching piece that UTMB has. So I think providing this extra space for those residents when they come in for their programs is going to basically get us above some of the other hospitals that have residency programs and get the higher caliber students that we want to get down here as part of this teaching program. Anyways, these are some ideas we're going to be rolling out as part of the League City expansion project. I've already got the team lined up to get the right consultants that I mentioned earlier on, so you'll be seeing those proposals coming through here shortly. The budget is set up, and so if you got any questions about this or anything you want to add to it, feel free to. We can get together anytime you want to. If you got any questions, I know you don't have any now. We can go ahead and give you some time to marinate on some of these ideas and anything else you may want to implement too as well. I'm going to the Healthcare Symposium conference at the end of September in San Diego. We're going to be looking at some new technologies out there. They're going to be rolling out the latest and greatest technologies they have with building components inside healthcare systems. We're going to be going and visiting University of Southern California or San Diego, UC, University of California, San Diego, is doing a tour of a brand new hospital they just built. And I'm going to go on that tour and tour that hospital to see some of the new technologies that they've implemented too as well, and some lessons learned on the job that I plan on bringing back to the team and sharing with the team that will incorporate with the League City project. So anyways, I know I've taken enough of your time. Appreciate your time today, and we'll talk soon.